Going to be a long road. Texas still in the early stages of recovery from Hurricane Harvey. One key issue facing people returning to their homes is the danger of contaminated floodwaters. Officials warning people to stay dry. Joining me now, Dr. Devi, an associate professor at NYU School of Medicine. Good to see you again.
Good to see you too.
I've heard on Fox and Friends this morning, everyone thinks, okay, you've got to send bottled water and there's all kinds of food and other supplies. But there was a person saying bug spray is one of the most important things, all that water and the mosquitoes.
You're right. When there's standing water, then you can see more mosquitoes and bugs crop up. Now there's also an issue of other animals trying to seek shelter from the storm, right?
Snakes, alligators.
Alligators, yeah. People are finding these animals in their homes, so that's an issue, especially since the water is contaminated, right?
So talk about that. Break that down for us. Contaminated in what ways?
Well, with bacteria. So, for example, these are rural areas that have septic tanks. So this flood water is basically mixing with this sewage tank water. Think Shawshank Redemption, right? And then that water is coming out into people's homes. So, being exposed to it is bad enough, but your skin is a barrier. So your skin will protect you from a lot of these things, at least in the short term. But if you have punctures, if you've broken the skin, other wounds, then those can easily get infected with the bacteria.
What are you hearing from colleagues and whatnot about what kind of medical care people are getting on the ground? So if, say, your child goes out in some of this standing water, you think they're exposed to bacteria, how hard is it to get in to see a doctor right now?
Well, it's very difficult. First, because a lot of people with existing medical issues, for example, more serious emergencies, are also trying to get in. So there's an issue in terms of medical care. You have short staffing, you have limited supplies and medications, and then they're trying to operate in a triage situation, like an emergency room, where they try to see the sickest people first. So, of course, every health concern is important, but the sickest people are probably the ones that already had medical conditions, for example, and they don't have access to any medication. So, for example, a diabetic who's run out of insulin, a person who's on oxygen who's lost their oxygen.
So what do you do in that case? Because you're right. So if you're diabetic, you have blood pressure, you need your medication, and let's say you haven't been out of your house in a few days, or you've just gotten out, but you ran out to save your life, your family's lives, and didn't grab your medication. What can you do?
Well, this is the biggest problem. So people are trying to go to the convention center or the hospitals or these other stops to get these supplies, which may still be limited there. So, for example, pharmacies, even if you get to the pharmacy, there's no guarantee it's going to be open. There's no guarantee that they actually got their deliveries too, because they're affected by the flood.
Made the shipment to the pharmacy.
Exactly. So those are issues. And now some of the bigger things are also patients with cancer who are not able to get their chemotherapy, or patients with renal failure, kidney failure, and they can't get dialysis. So, for example, with dialysis, you have to get it every 2 to 3 days to get all those toxins out of your body. So we're seeing a lot of these problems with people who have existing medical conditions. And I think over the coming year, we may see newer medical problems as well. So there are people who, for example, as the floodwaters clear, you're going to see mold and other things cropping up, and then people exposed to these things. People who have stress disorders right now who are going to have post-traumatic stress disorder over the coming year.
Last question. In the early stages of the crisis, I remember at least one hospital being evacuated because it was taking on water. How much more anecdotally have you heard about hospitals, medical centers who are already under stress and pressure from people trying to come in and get care, and how they're dealing with the floods?
Well, I mean, it's a tribute to actually the staff, the volunteers, everybody who's working above and beyond to try to take care of all of these patients. I mean, I can say from Hurricane Sandy here, there were problems with the hospitals because you don't want people to come to the hospital and get sick, right? So you have problems in terms of ventilation, in terms of other factors. So people could come to some of these places, get sick. I'm not saying that's happening there, but that's going to be a concern over the coming year, that, all these hospitals have to be evaluated again to see what else has brewed there.
All good advice. That's why we brought you in, Dr. Devi.
Nice to see you.
Appreciate it.